Welcome, everybody, and we are so glad you could join us today for the From WAGs to Wellness webinar presented by our partners at Lovett Pet Healthcare. So whether you're tuning in here from Chicago or joining us virtually from other parts of the country, we are thrilled to have you with us. My name is Sheila Gidley, and I am the Executive Director here at Canine Therapy Corps. So for those of you who may not know us, our mission, the Canine Therapy Corps mission, is to empower and motivate individuals to improve their physical and psychological health and well-being by harnessing the human-animal bond. We provide goal-directed, interactive, animal-assisted therapy services free of charge using volunteers and certified therapy dogs. And we advance animal-assisted interventions through research and collaboration. Now, the heart of our mission really centers around what's called goal-directed animal-assisted therapy. We train volunteers and their dogs to work with people as part of the actual treatment process. Using dogs as part of goal-directed therapy has been shown to increase patient motivation. Sorry, I'm just letting a few more people in. Sorry. So using goal-directed therapy has been shown to increase patient motivation, I can't even talk today, helps people persevere during difficult or even painful sessions and make it less likely for a patient to drop out of therapy prematurely. Our goal-directed therapy services are provided free of charge to Chicago area hospitals and other health and human service organizations. We provide visitation services to schools, hospitals, and assisted living facilities and so on to bring stress release and comfort. And we also offer training classes for dogs at all levels, whether or not they have aspirations of becoming a therapy dog. So you can learn more about our organization at our website at caninetherapycorps.org, and corps spelled like Marine Corps, C-O-R-P-S. So caninetherapycorps.org. So we hope you'll take a moment and visit after the webinar. But for today, we are absolutely thrilled to partner with Lovett Pet Healthcare. Their support not only sustains our free programs, but they also help us look ahead to the future of therapy work. Together, we collaborate on identifying potential therapy dog candidates and on sharing educational content like today's webinar that give pet parents practical tools to keep their dogs happy, healthy, and ready to make a difference. So it is now my pleasure to introduce today's presenter, Dr. Renee Mead, who is a veterinarian at Lovett Pet Healthcare. Dr. Mead is a compassionate and highly skilled veterinarian specializing in canine and feline medicine with advanced training in internal medicine, wellness care, and surgery. She earned her Bachelor of Science in Biological Science from Oklahoma State University in 2004, followed by her Doctor of Veterinary Medicine at, sorry, I just got interrupted there. Is followed by her Doctor of Veterinary Medicine in 2008. So during her clinical years, she was honored as the American Association of Feline Practitioners Senior Student of the Year, and also received the Above and Beyond Award for her exceptional compassion towards pets. Over the years, Dr. Mead has built a reputation for providing comprehensive, thoughtful care, always tailoring her approach to the unique needs of each patient. She stays at the forefront of veterinary advancements by attending continuing education programs regularly. Outside the clinic, Dr. Mead enjoys reading, good food, nature, and traveling. She has a deep love for Chicago that brought her back from Texas, and she embraces all the vibrant culture, cuisine, and entertainment the city has to offer. Now, before I turn it over, I did want to let everybody know that we will be pausing a couple of times during the presentation for Q&A. So use the chat feature to type in any questions. We have Stephen Gregory Bram here from the Lovett team who will be moderating our Q&A. So Dr. Mead, with that, I'm going to turn it over to you.
Thank you, Sheila, for that very warm.
Oh, you know what? We cannot hear you. Can everybody else hear her?
Can anybody hear me?
Perfect. Oh, now we can, or at least
okay.
I can.
I might have to speak up. Can you hear me better now?
Yeah.
Okay. Thank you, Sheila, for that warm introduction. It's very nice. So a little bit about us at Lovett. Our vet care is easy to love. That's my first dad joke, be forewarned. But honestly, we are a judgment-free zone. We're focused on removing barriers, financial, emotional, and logistical, We want our pet parents to feel supported and less overwhelmed when it comes to their pet's health. That's our main focus. We provide a full range of services, primary and urgent care, dental and surgery, so families can get timely, appropriate care when it's needed most. Also at Levitt, we recently released the Levitt Checkup Report, which was a research report we commissioned to better understand the challenges pet parents are facing today. The report shares the findings of research data conducted by Census-Wide on behalf of Levitt Healthcare, capturing the emotional and financial pressures of pet ownership today. The gap in preventative care and what pet parents say they need the most to stay ahead of their pets' health issues, while also giving us a closer look at what is happening here locally in our communities in Illinois. One finding that really stood out to us was that 45% of pet parents nationally said the rising cost of vet care has caused them to delay or skip their pets' visits in the last 12 months. That tells us just how common financial barriers can be when it comes to getting care that the pets need. That's why at Levitt, we focused on making care more accessible. We recently introduced flexible payment options, primary care plans, and have removed barriers and added digital tools that help families get timely, affordable support. We recently introduced our Levitt Essentials Plan, which is a primary annual care plan. It bundles key preventative care such as unlimited exams for the year, vaccines, lab work, and even important surgical procedures such as comprehensive dental cleanings, spays, and neuters in the bundle for the year. This plan saves the pet parents 30% off of the cost of their annual care for their furry family members, and it provides a predictable payment every month that helps remove those financial and emotional barriers for care. Levitt is also a proud supporter of Canine Therapy Corps in the amazing work that they do in their training programs and with their certified trainers. And most importantly for our community, the free therapy dog programs. So at Levitt, we can help guide you in your dog's therapy assessment. Any dog at any age can become a therapy dog if they want to. Next slide. So the topics we're going to go over today, the big things: your dog's body language to help you understand what they're really saying, their potential as a therapy companion, and how to build trust and reduce stress in any environment for your dog. Next slide. So part one, what your dog's body language is really saying. Dogs communicate in subtle ways. We often miss the signs. According to our checkup report research, approximately 30% of pet parents say they often feel very anxious or worried about when their pets show signs of illness or unusual behavior. We have found this to be consistent here in Illinois and in the Chicagoland. This highlights why being able to read your dog's body language is important, and medically for assessment as a future therapy dog. Many of the subtle cues we talk about today can be easily overlooked, but it is important to note that they reveal a lot about your dog's stress level and discomfort. First thing I would like to discuss is anxiety. Some of the most overlooked signs of anxiety are licking their lips or licking people, panting when it's not hot, yawning, tail tucking, ears back, and moving or looking away. I find that most people are surprised to learn that yawning and licking are signs of anxiety, as yawning is often associated with tiredness before a nap, but it's a cue, especially in an active environment, of anxiety. Licking is not just being friendly in those active environments. It often is a calming act for dogs and can indicate anxiety too. Two very important points. If there is one pearl that you remember from this lecture today, I want it to be this. And this is about pain. So when it comes to pain, many of us as humans associate pain with yelping or crying. And this may be the case for immediate or acute pain in dogs, but chronic pain looks different. The most common things pet parents tell us that are signs of chronic pain are their dog is slow to get up in the morning, he hesitates to sit down or walk, or limps after an extended rest. Those are all signs of chronic pain. Dogs are very stoic in nature, and I have found as a veterinarian, they're extremely stoic with chronic pain. Just a quick little tip on acute pain. On the flip side, sometimes limping or pain occurring at home will disappear in the clinic, which is extremely frustrating for pet parents. But that is something that will happen with adrenaline in the hospital, and that tends to be more acute pain related. Next slide. Okay, now on to the fun stuff, the stuff you guys came here for. So let's explore your dog's potential as a therapy companion. Some of you tuning in today may already be active Canine Therapy Corps volunteers with an approved therapy dog, and that's wonderful. Others may be in the process of exploring whether a therapy dog would be right for you and your pup. So one of the most important things is confidence. Confidence plays a big role in therapy dog work, especially in unpredictable environments that the therapy dogs frequently work in. Therapy dogs are enthusiastic and not just working. They want to be there and do that job. It's important to look for signals that your dog is enjoying what they're doing, not just working. And the role of a therapy dog in unpredictable environments plays a big role in whether you and your dog feel prepared. That's why reading your dog signals and knowing when they're truly comfortable is an important foundation for therapy work. I would like to stop there because I know Stephen may want to ask some general questions, and I've probably rolled over where he wanted me to stop already. So Stephen, can we ask some questions and see if anyone has any questions that need to be answered right now?
Yeah, hi everyone. Stephen Bram here with Love It Pet Healthcare. No problem at all. Just a reminder, if you have any questions, feel free to drop them in the chat. But with Dr. Mead, would love to kind of circle back on that first part. Some cues that, like you mentioned, like panting or pacing can show up in a dog who's anxious, but also when they're excited. So in your opinion, how can owners tell the difference between positive excitement and concerning stress?
So they will often have their ears back with the licking behavior, or they will see anxious with their tail tucked, slowly coming up to someone or hiding in a corner. And the panting is almost always if they're distant from whoever they're being introduced to. So you can generally tell when a dog is warming and welcoming versus anxiety and panting. You just have to be keen to those signs.
Got it. Okay, super helpful. And just another question, when a pet parent does notice these subtle signs, like what's the best way to share that info with their veterinarian so it leads to more of an accurate diagnosis?
Comparing that behavior to at home and how the pet acts with other pets or people that they know versus in the new environment or the active environment.
Got it. Perfect. Thank you. I think we can continue on. And then again, feel free to drop any chats that come up whenever you're ready.
Okay, sounds great. So let's go on more into the therapy dog section on assessing whether your dog might be right for therapy work. So as Stephen just mentioned, reading your dog's signals and knowing if they're truly comfortable is a very important foundation in therapy work and in general with your pet and your relationship with your dog. This section can be helpful for anyone interested in what makes a dog successful in public facing and people-focused environments that the therapy dogs often work in. And the trainers at Canine Therapy Corps can help you start a good foundation in making your dog successful, not only as a potential therapy dog, but in life, in forward-facing environments, on the street, and around new people. For those considering volunteering with Canine Therapy Corps, any dog of any age can be a therapy dog. There's never a dog that's too old to learn new tricks. Second dad joke. If you're counting. The traits that often indicate potential in therapy dogs include a calm temperament, adaptability, and comfort around new people and environments. Signals of dogs that may prefer quieter environments than therapy dog work may be signs of anxiety, such as panting, avoidance, lip licking, or tail tucking, as we previously discussed. Therapy work may not be the best fit for those dogs, but I would still recommend assessing with a trainer if that would be the case. So spotting these cues early can help you set realistic expectations and make sure training starts on the right foot. Just to reiterate to everyone in our community listening, any breed can be a wonderful therapy dog. It's not just golden retrievers or labs. It can be beagles. It can be bull terriers, pit terriers. It all depends on the temperament of that specific dog. And any age of dog can be a therapy dog. In puppies, if they are playful, they may need to still grow to be a therapy dog. So that should be considered, but I highly recommend starting with that training and see where they can go. The most important thing, my second pearl, is that they enjoy what they're doing. It's not just a job. They need to enjoy being a therapy dog, because the person that they're working with will feel that, they will feel that, you will feel that. That is by far the most important thing. For those of you that already have approved therapy dogs, it is important to keep checking in with your dog, knowing their comfort level and making sure that there aren't changes over time to their stress. And this can depend on their age, their health, or any new stressors that they've had in their lives. Watch for shifts in behavior, like slowing down, becoming less eager, and showing those subtle signs of stress we already talked about. Be willing to adjust your workload for your therapy dog if they do show signs of stress. So just stay in touch with your dog for that so that you can continue doing the work that you need to do. Therapy work should always be a positive experience for the dog, not just for the people they serve. And that is a very important noted thing also. So any questions? Stephen?
Yeah, so we have one here in the chat.
Okay.
ESA dogs good candidates for therapy dogs?
That depends. So if they've went through training, so ESA dogs do not always need training or certification to be an ESA dog. So it depends on the individual dog and their temperament and how they do in stressful environments. An ESA dog can be very supportive to their person and not necessarily be calm in an excitable environment. But sure, I would recommend assessing your dog. If they are good in public places, the trainers at Canine Therapy Corps can walk you through that. I would not hesitate to see, because it's definitely a path to move forward on.
Great, thank you. Thanks, Tiffany, for that question. Question more so on like the human side. So how can handlers prepare themselves emotionally to step back or pivot if their dog isn't thriving in therapy work? Are there other outlets that you would maybe recommend, even if they themselves really want to continue?
I would give them a break for a bit, take them out of that stressful environment and reassess them, see where they're at, see what that stressor might be, see what caused that change in what they're doing. I have personally found therapy dogs, as they get older, things like arthritis can affect their ability to work. So I would have them checked out, bring them in, let us take a look at them, see if there's something that can move them back into that role of wanting to do that job and being eager to do that job, and go from there.
Perfect, thank you. I think that's all the questions, so we can move on to the next.
On to the next slide. Okay. Looks like, oh, here we go. Okay. Okay, now this section, me as a veterinarian, is probably my heart, because it talks about stronger bonds through puppies and that initial training, and even in older dogs, you can do this too. So this is really the core of building your way up to a therapy dog in conjunction with certified training. So stronger bonds with your pet will be made through training. The best tool is positive reinforcement. Start early, if possible, with puppies. Teach them that walking on a leash and meeting new people are positive experiences, and capture that desirable behavior. When they do something good, reward them. Choose 1 or 2 behaviors each week that you want your dog to do consistently, focusing on those desirable behaviors when they do them naturally. So rather than correcting undesirable behaviors, we want you to build a stronger relationship without force or stress with your dog. And this can be done initially with small treats or kibble when they perform that positive action, rewarding them. Throughout the day, when your dog offers that behavior that you're looking for, that positive behavior, encourage them with a treat and eventually a clicker or a verbal word or a cue that will capture that good behavior and reinforce the likelihood that they will repeat that behavior in the future. For each item, 1 or 2, you work on for a week or 2 and not introduce too many at a time so that they can learn those positive behaviors. And as you grow, those behaviors or those trainings can become more complex. Start with simple and work your way up to more complex for the dog. Dogs are smart, and if you teach them the basics, they will work their way up to those more complex things. So next, another pearl is that focusing on cues and not commands. Very important, cues, not commands. So for example, associating a sit with a hand gesture instead of a shouted word is very helpful, especially in noisy environments, such as what therapy dogs can sometimes work in. They will look at you for that cue. So a visual cue keeps them focused on you, calm and confident in any environment, even if it's noisy. For those of you that already have therapy dogs, know your dog's triggers. Dogs will have triggers just as people do, and prepare with training and always prioritize the dog's comfort, their comfort. Stay aware of the environment, anticipate any challenges when you can, and remember you are your dog's biggest advocate at all times. If you'd like more help, we recommend Canine Therapy Corps and their certified trainers. They're great. They do wonderful work in the community, and they do wonderful work for those in need with their therapy dogs. I think that is pretty much it for me. This wraps it up. We can do some more questions. I do want to thank you all for joining us today and remind everyone that our flagship hospital, Lovett's flagship hospital, is here in the Chicago West Loop. We are always happy to be a resource for you and your four-legged friends. And you can find more information on us and our hospitals at lovett.com. Sheila?
Terrific. Thank you so much, Dr. Mead. And thank you to our friends at Lovett Pet Healthcare. We hope that everybody got something from this. And if anybody has any questions about becoming a therapy dog team or just training in general, you can go to our website again at caninetherapycorps.org. And we have a 15-minute evaluation, and you can kind of come in and talk to the trainer about, you bring your dog in and let the trainer meet your dog, and you can kind of talk about, where to kind of start with your classes. And just kind of backing up in terms of those of you who do want to get into therapy dog work, your dog does have to be at least 1 year old to take our test. And again, there's information on our website about what the requirements are and so on. So any more questions before we leave? I just want to see.
We might have one more in the chat from Gabby. So I have a quick question. Do you not only accept pet insurance, but also offer any discounts for therapy dogs, particularly for things like pain management or acupuncture? My dog is about to turn 2 and is already dealing with luxating patella issues. And since he's a working therapy dog, I'm hoping to find support that helps keep him healthy so he can continue helping others.
Yes, we are working. I know at the hospital level, we are working to assess those discount programs, and they're changing as time goes on, especially as we learn more of the Chicago land here. So yes.
Thanks, Gabby.
Any
Okay.
other questions? I think that's it.
All right. Well, a recording of this will be available. Starting today is Tuesday, so starting Thursday, if you go to our website, you will be able to find a recording of it. And I do believe that Lovett will be sending out some information as well and on social media posts. So if you have any questions, you can reach me or Dr. Mead, and we would be happy to speak with you. Thank you so much, everybody.
Thank
Take
you.
care. Have a good day.
Thank you.